Hey folks, my name is Mo Amir and this is VANCOLOUR, British Columbia's bona fide culture and politics TV talk show. Tonight, we focus on healthcare in BC. If medical wait times actually make your health worse, can you sue the government? Kyla Lee will share her verdict. Plus, last year, BC was the first province to set minimum nurse-to-patient ratios in order to improve the well-being of nurses and patients. But are these ratios even being implemented? The president of the BC Nurses Union is here to explain, but first, well into the 10th year of BC's toxic drug crisis being declared a public health emergency, BC's Ministry of Health says that it funds 3,700 treatment beds across the province. But do those numbers actually add up? Here to discuss, the Conservative Party of BC MLA for Skeena, Claire Rattée. Claire, what an honor. Thanks so much for being here tonight.
Thanks for having me.
So, does the government have a definition for treatment beds? Because you and I might see it differently, but is there a established definition of what they call a treatment bed?
They do. Each health authority has a very slightly different one, but the general concept that is the same across all of them is that it's clinical, evidence-based, it's bed-based, that there is, that clinical component to it that would mean some structure, that you would have health professionals working there, and, what the public would typically think of as a treatment bed, meaning somebody goes, 30, 60, 90-day stay, they're getting treatment in a clinical setting to help them deal with addiction.
And I assume that treatment beds differ slightly depending on the stage of recovery you're in?
Yeah, so there's bed-based treatment, which is what I think the general public thinks of as a treatment bed, and it would also match the same description that the ministry uses. Then there's also supportive recovery beds, which is kind of like a second stage. So it's going to be more peer-led. It's going to be very much so less clinical, I would say, right? And
are those included in treatment beds or only that first stage?
This is the problem, is that when the government talks about treatment beds, they're including that. They're including detox, any of those kinds of forms of detox, because there's a few different forms. Sobering assessment beds, the list goes on. There's a lot of different things that are being included in that one number.
Okay, so is that what you found when you dug into the numbers? Like, is that the key issue, that there's a lot being conflated together as one definition?
Yes, absolutely. They're lumping everything together as being treatment. And while it's all part of treatment and it's part of that recovery process, when you tell people that there are 3,700 publicly funded treatment beds in the province, and that's not the case, in the public's mind, they're thinking there are 3,700 clinical bed-based treatment beds out there, and there aren't. Okay,
so based on your digging, how many treatment beds in terms of clinical treatment beds actually exist in the province?
So the first problem is the government has said there's 3,700 publicly funded treatment beds. The document that they provided me, their own document that tells me every single one under that whole umbrella of what encompasses treatment, if memory serves, it's 2,136 beds. So
that's a big difference.
That's a huge difference that I can't. I can't understand.
That's less than 2/3, I guess.
Yes. Yeah. So it's a significant difference. Now, if you take all of that data and you look at just the bed-based treatment, which is that clinical aspect, which is really what people are needing right now, and where that pinch point is, where people are having really long wait times, there's actually only 806 in the province.
Wow. Okay, so this becomes an issue that I believe is nonpartisan, because it's about data, it's about definitions, it's about accurate information being reported by the government, right?
Absolutely. Yeah. I mean, it's just about accountability, right? People deserve the public deserves to know what is actually being funded and what do we have access to and why are the wait times so long and why are we not seeing success? And I think that does come down to looking at the numbers as well as a number of other things. But the number of beds is an important piece because it is about accountability. It's about telling the truth.
Right. Now, CTV reported recently that the wait times have actually reduced quite a bit in terms of being able to access a publicly funded treatment bed. They said that in a lot of cases it went from months to weeks. I think weeks is still long and when someone's ready for recovery, but isn't that the larger point that, well, regardless of the numbers, things are still getting better in terms of access to treatment?
The problem I see there is that, again, two things are being conflated. The Road to Recovery program that they're running out of St. Paul's Hospital is part of the reason why those wait times are down. And that's a good thing. But the problem is that the wait times are down to access detox. They've made it so that you can rapidly access detox. And I've spoken about this very publicly for a long time. Detox is not the whole picture. It is not the answer. And actually, if we're reducing barriers to detox while still maintaining barriers to treatment, it's actually more likely to have the opposite effect and kill people.
Okay. Now, unfortunately, we don't have time to fully discuss drug policy here. But again, sticking to this idea of data and reporting, what can be done to hold our government accountable so that accurate numbers are provided to the public?
Yeah. I think it would start with the government actually telling the whole picture and explaining to the public what is available, what are we funding, how many beds are there, and what type of beds are they. I shouldn't have had to dig as hard as I did to be able to get that data. Another piece of it is going to be looking at tracking outcomes and actually implementing some kind of system that they can track those outcomes with. Now, I know at St. Paul's they are beginning that work, but I think we've got a really long way to go before we're having accurate tracking mechanisms and we're being honest with the public about what is available.
I just feel like for the amount of public service that the government has expanded over the last few years, you would have people that would be able to track this data.
Absolutely. I mean, we've got a massive bureaucracy, not to mention all the advancements in technology. The ability to automate a lot of that work, I think is certainly there. And we've seen it in other provinces. There's models out there that we can adopt. You don't have to reinvent the wheel. Just talk to another province about how they are tracking their outcomes and their data and try and find a way to implement it here, make the adjustments that are, pertinent to our province. But the systems are out there. We're just not utilizing them, in my opinion.
Absolutely. Well, Claire, I want to thank you for flagging this very important issue. I think it affects all British Columbians across partisan lines. This is about transparency, data, and it affects a very big public health emergency. So I appreciate your work on this, and thank you so much for your time tonight.
Absolutely. Thanks for having me.
Folks, that was BC Conservative MLA for Skeena, Claire Rattée. Now, after some business, the province promised safer working conditions for nurses by implementing minimum nurse-to-patient ratios. But are those ratios actually being implemented? We'll talk about it up next.